Hello, my name is Carrie Rice. I am the Healthcare Epidemiology Improvement Coordinator with the Maine CDC, and today I'm going to be discussing personal protective equipment supply shortage strategies as it relates to N95 and respirators. The first thing we want to look at when we're talking about respiratory protection and controlling exposures is ensuring that we have a hierarchy of controls. And PPE, or personal protective equipment, is just one part of this larger process. And just as a reminder, N95 respirators are intended to be used once and then properly disposed of and replaced with a new N95 respirator. And this is the optimal way to prevent airborne transmission, along with these other combination of interventions, such as engineering controls, isolating people from the hazard, looking at your airspace and your HVAC systems, etc. And so these are normal routine operations that should be employed for any type of airborne illness. And we're going to move forward a little bit when we start talking about supply strategies in times of supply crisis. I also want to direct and highlight additional education that is available on the Maine Infection Prevention Forum website, and is a webinar that was held in conjunction with MHCA and OSHA and Maine CDC, where we went through the entire process of what should be included in a comprehensive respiratory protection program. And you can find this on the Maine Infection Prevention Forum website. Additionally, there are some templates and documents that you can use to help get your program started, such as a plan template and also a line listing if you're looking to track medical clearance and fit testing. So feel free to take a look at this. It will help if you're trying to improve your respiratory protection program or just get it off from the start and you're not entirely sure what should be included. I will not be going over the complete processes that should be employed for a respiratory protection program within this tutorial. Here, I want to highlight a few key points on respirator use, noting I will not be going over the complete start to finish process, but just want to highlight some of the key important areas. And one of the important areas when we look at donning or putting on a respirator is the performance of a fit or seal check. And this is something that should be performed every single time a respirator is put on, and that's to ensure that you have that proper fit and seal so that it will work appropriately in the intention that it is meant to be used. Now, another thing to remember is at any time, if an employee, staff person, or yourself is wearing a respirator and you have difficulty breathing, you're feeling dizzy, or you have other issues, it is important to immediately leave the area when you can and appropriately remove your respirator and check things out. The next key step I want to highlight is on doffing or taking off a respirator. And what is important here is to make sure that you follow the appropriate steps per your institution so that you take it off in a manner not to contaminate yourself or to contaminate your environment. And hand hygiene, always very important. Now, I've included at the bottom of this slide some infographics which have pictures and detailed instructions about respirator donning and doffing. And it's also important to note you should follow your institution's policies and manufacturer's instructions, as there might be slight differences depending upon the type of respirator that you are using. This is just, again, some more respirator use. So again, just highlighting in routine times, just disposables are not meant to be cleaned and sanitized, and routine inspection is still necessary. There's some nice pictures on the side there what talks about things not to do with your respirator. Definitely not wearing it around your neck. Don't ever want to put it into something where you can't have, where you have an airtight seal, you don't want any moisture buildup, etc. like that. But you can go through this and just as some information when you're thinking about and creating training manuals or processes or competencies and going through processes with your staff. You want to make sure that they understand all of the specifics of respirator use. And you can find more information at both OSHA and CDC website as well. Now let's talk about the actual supply capacities. And so there are three different capacities. The first is conventional capacity. And these are measures consisting of engineering, administrative, and PPE controls that should be in place all the time, regardless of pandemic. This is our normal routine everyday operations. Under conventional capacity, generally an N95, if it's disposable, should be discarded after the interaction with the specific client, patient, or resident. Now, in times of our pandemic, when we're looking at our specific processes, of caring for residents, caring for patients, there may be times where you are looking at the extended use of N95 respirators when they're being used for source control only, not when they're being employed as personal protective equipment. Now, this would be in lieu of, say, a face mask or a face covering. And when you're using it for the purposes of source control, it may be used until it becomes soiled, damaged, or hard to breathe through, and then it should be immediately discarded after removal. Now note, this is an exception to use this extended use practice as source control. If you're going to then use this practice, but you're going to be using it as PPE, i.e. caring for an individual who is confirmed or suspect for an airborne transmission organism, then you will be moving into the practices we talk about in contingency capacity. And we need to look at that. So really take a look at this when you're looking at your practices. You want to ensure that you're using extended use appropriately. You also want to ensure that you have appropriate training for your healthcare providers so they know what the difference is between source control and when it's being utilized for personal protective equipment. The next capacity strategy is contingency capacity, and these are measures that may be used temporarily during periods of expected N95 respirator shortages and should only be implemented after considering and implementing conventional capacity strategies, meaning you've exhausted your potential resources and or processes and you need to look further on how you can maintain your supply. Now, the practice underneath contingency capacity is extended use. Note, this is slightly different from the extended use language and processes we talked about under conventional capacity. And so within contingency capacity, when we say extended use, we mean the practice of wearing the same N95 respirator for repeated close contact encounters with several patients, residents, or clients without removing the respirator between encounters. It is preferred over reuse, which we will talk about next in crisis capacity, because it involves less touching of the respirator and therefore less risk of contact. Now, when you're practicing extended use over a course of a shift, there's a couple considerations you should look at. One, the ability of the N95 respirator to retain its fit, because as we know, as you continue to wear a respirator, it might change its shape, mold, fit. So you want to make sure that as you continue to wear it, you're getting that good fit, you're getting that good fit and seal check, and that so it will be appropriately functioning. Two, you have to think about contamination concerns. Is there any point in time that it has been contaminated? If so, it should be discarded. And then there's also practical considerations such as meal breaks and the comforts of the user. Now, with extended use under contingency capacity, it should be discarded immediately after it is removed. So this is not a time that you would store it and save it for use later. Once you take it off, it would be discarded. So as an example, if it was removed for a meal break or a drink, the respirator should be discarded and a new respirator put back on after. Always remembering that when you're donning a new respirator, you should make sure that you're doing your fit or seal check these to ensure you have that appropriate fit on the face. This slide here is just once again pointing out some of the key points under contingency capacity with extended use, which we discussed, which is talking about the considerations, your ability to retain its fit, contamination concerns, potential considerations about meal breaks, comforts, that it should always be discarded immediately after being removed, and that you also can look at other methods that you might prevent contamination of that N95, such as a face shield or surgical face mask over the respirator to reduce that contamination. And just wanted to really highlight this so that staff understand the difference between extended use and what we're going to talk about next, which is limited reuse. So that you know there are times when it should be discarded, when you should be getting a new one, to make sure that they are protected appropriately and that also the residents, patients, and clients that they are taking care of are appropriately protected as well from cross-transmission. So what's the next capacity strategy? It's crisis capacity. And so these are strategies that are not commensurate with US standards of care, but may need to be considered during periods of known respirator shortages. Again, should only be implemented after considering and implementing conventional and contingency capacity strategies, meaning you should try to employ extended use prior to going to this next level of crisis capacity. And again, you need to do that risk assessment. And when we're looking at the risk assessment, it's determining, one, do I have the proper education and training? Do my staff have the knowledge to do safely? And is this something that we can safely implement at our facility? And so the strategy under crisis capacity is limited reuse. And this is the practice of using the same N95 respirator by one healthcare provider for multiple encounters with different patients, residents, or clients. But you're going to remove it, doff, after each encounter, and you are going to store it between those encounters, and then it is going to be put on again or donned prior to the next encounter. And so this is a process that does take some steps. It does take training. I'm going to go through some of the guidelines for doing this safely and appropriately, because there is more risk associated with this, because you're redonning a previously used respirator, which may be contaminated on the outer surfaces. And so what's important with limited reuse is you have to ensure that you have proper fit and function of that N95. So first, it's important to consult with the respirator manufacturer so you can determine if they have a maximum number of donnings or uses that are recommended for the respirator make and model that you have. And reason I bring this up is there is a general recommendation from federal CDC, if there is no manufacturer guidance, that the number of reuses is no more than 5 donnings per respirator by the same healthcare provider. So no more, that should not be put back on no more than 5 times. The specific manufacturer may have different specific guidelines for that respirator, and that is something you should be made aware of. The reason for this is when you're putting on a respirator, every single time you put on a respirator, you should always be inspecting it and doing a seal check or a fit check. And doing that, you're making sure that you have that proper seal that we talked about before. And over time, this can alter that structural integrity. Additionally, when you're storing it in between, you want to make sure that you're not messing up that structural integrity anyway when you're storing, either crushing it, etc. And so that is why they have these limitations to donnings, because the more you don it, the less you have less likelihood of that proper fit and seal, thus more risk associated to the healthcare provider. An N95 and other disposable respirators should not be shared by multiple healthcare providers. It needs to be healthcare provider specific. Now, contamination. At any point in time, extended use or this limited reuse, if the respirator becomes soiled or grossly contaminated with blood, respiratory nasal secretions, or other bodily fluids, it should be discarded, regardless of how many times you have donned it off, wherever you might be in your process. Some methods to decrease contamination: you could consider using a face shield or a face mask over the respirator to reduce and prevent contamination, especially when you're performing things like aerosol generating procedures or times where there might be anticipation of splashing or spraying. The other thing you want to think about is the appropriateness of limited reuse, depending upon what you might have in your resident or patient population. And so there are times when it might not be appropriate to store that respirator for later use and put it back on. And so some examples would be, if you're caring for patients or residents with varicella or measles, that should not be redonned, that should be discarded. So you need to look at the whole picture and make sure that your healthcare providers understand this and know the risk associated with it. Last thing I just want to point out is about storage. So you want to make sure that we talked about before, you're storing respirators in a way that you're not going to alter their structural integrity. You want to make sure that they are stored so that they're not having contact with the environment, that they're not having contact with another healthcare provider's respirator, that healthcare providers know which respirator is theirs, and that you are doing it in a way that you're going to prevent moisture retention. So it is important to have a process to do this. having a designated area can help. And then additionally, depending on what you're using as the storage mechanism, you want to make sure that area is cleaned on a regular basis so you're not contaminating your environment. So we have some pictures on the side of some examples of how this might be done. And so this is something that when you're doing that risk assessment of your entire process, you want to look at it from start to finish to ensure that you have a process that you're not going to have any cross contamination to your healthcare providers and also your environment. So here just want to point out that during times of crisis, you're having a real hard time with supply, practicing limited reuse on top of extended use could be considered, but that there should be some cautions taken. And one is an understanding that the surfaces of N95 respirators will become contaminated with pathogens as they're doing their purpose of filtering the inhalation of air of the wearer during exposure to pathogen-laden aerosols in the environment. And they need to be aware of any degradation of the respirator. And so this is where it's really important, again, to do those fit seal checks to make sure that you're not exceeding the maximum amount of donnings per the specific instructions of the manufacturer and or the fallback of no more than 5, depending upon the policies of the manufacturer, if there's some available or if there's none available, which we discussed in the previous slide. And then just also thinking about and working through potential situations with your staff when you're doing education and training to ensure they understand all of these parameters. And so here are just some examples of some limited reuse scenarios. Let's say a healthcare worker wears a respirator to care for a patient. They remove it after exiting the room. They store it appropriately, and then later they return to care for that patient and they put on the same respirator again. This would count as 2 uses or 2 donnings. And so that's another important piece to think about this, as we discussed, is they need to keep track of how many times they have put it back on so that they're not exceeding that maximum amount. If they exceed and they go past, there's more risk to them in not getting that appropriate fit or seal and therefore not being appropriately protected. Now, another example, let's say a healthcare worker wears a respirator during the first 3 hours of his or her shift. They remove it to eat lunch, store it appropriately, and they put it back on after lunch. This also would count as 2 uses or donnings. And so just make sure you have a good process for this and that your employees or staff understand how to use it. So now let's talk a little bit about these extended use, limited reuse, and directional flow of PPE. So when we are looking at how can I do these extended and limited reuse processes, we have to think about the impact between our patient populations. And so to reference some of these populations, I'm going to use a color scheme. So green will refer to individuals with no COVID, no infection, or naive. Yellow will refer to an asymptomatic quarantined individual. So they've had an exposure, they're a new admit, they are on quarantine, they're not actively symptomatic, they're not actively infected, but they are being monitored. Orange will refer to a symptomatic individual, but no infection confirmed. Red will refer to a COVID positive individual and or unit. Now note, if you have units that are mixed, so if you have a unit that is a COVID-19 positive with some quarantined and or with some naive individuals, it would be considered red and you would need to wear full PPE for the entire population. So we're going to add a little diagram here to kind of demonstrate this. When we're looking at our directional flow, we want to be moving in one direction. And so you can move from green through to red. So what this means is you could have wearing appropriately, if you're looking at extending your PPE usage, you could move from green to yellow, you could go from green to orange, or you could go from green to red. You could go from yellow to orange, from yellow to red, or you could go from orange to red. Same thing, you could go from yellow to red. Just you can't be going back the other direction. So you can't be going from a red to an orange or an orange to yellow, yellow to green, or red to green, etc. And that is because you want to make sure you're not going to introduce something to a patient, resident, or client that they do not already have or potential for having. There's a couple other things you want to think of when you're looking at this directional flow. One, there should be no reuse of PPE between a known COVID-19 positive individual and a COVID unknown or negative, which is demonstrated by the color scheme that you see here. When we're looking at masks and eye protection and extending their use, that can be more safely done than gowns and gloves, and that is because eye protection can be disinfected per manufacturer's instructions, and you can wash your hands after doing that disinfection. With gowns and gloves, this is again where with gowns and gloves, but then also with looking at our process of flow for all PPE is we want to consider what else might be going on with this patient, resident, or client in addition to COVID-19. So let's say that you have an individual with a multi-drug resistant organism, and so that stands for typically bacterial or other agents that are resistant to the drugs that are commonly used to treat them, like say for bacteria, antibiotics. If you have a patient with MRSA, VRE, or a CRE, which you may have heard of in the past, and they have COVID, so you don't want to move from a COVID-19 MRSA patient to a COVID-19 patient because you would not want to be transmitting any of these multi-drug resistant organisms to that other individual. So you need to think about the entire picture of the clinical status of the person to ensure that you are not transmitting other potentially transmissible organisms. If your gowns are in low supply and use must be extended, if there is even a suspicion of a splash or a splay from blood or body fluids, then the gown should be changed. Additionally, we do not recommend hand sanitizing gloves or washing hands with gloves on to extend their use. This is for a couple reasons. Gloves can have micro tears for which things can pass through. And additionally, washing gloves can help contribute to product degradation. Therefore, you should be changing gloves after each patient-resident client interaction. And again, there's more guidelines down here with detail about PPE extended use and these processes, which I recommend going to and reading. But what I really want you to gain from this slide is thinking about when I'm cohorting patients and I'm looking at extending my PPE usage, making sure that I'm going in a flow, that I'm not going to cross-transmit any organism between a patient, resident, or client. And so what are the key points when we talk about these supply strategies? First one is implementation does come with risk. And so although there is benefit to maintaining supply when you use extended use or reuse, there's also risk for contact transmission. And so that's why education of appropriate practices is important. Two, it's recommended that the person who is responsible for the respiratory protection program at the facility review the CDC guidance, review OSHA guidance to ensure that they have an appropriate plan and processes in place for these practices. Three, that individual and/or their designees also need to make sure they have a good training plan so that staff are trained and educated and they understand the processes. Using practices such as return demonstration and really watching how they're doing it is a great way to ensure that they are doing it appropriately. Four is while you're employing these practices, you really should be monitoring and auditing the entire process during the entire implementation to ensure that one, it's being done appropriately. This also gives you the opportunity to do direct feedback with staff and retraining on the spot if you happen to notice that something isn't being done in the correct manner. Now, the other thing to keep in mind is there are some devices that have not been FDA cleared for reuse, and so you just want to look at your manufacturer's instructions to you know exactly what is important and appropriate for your particular respirator. And number 6 is remember to consider appropriate directional flow, especially if you are using these practices in conjunction with cohorting or mixing of different types of patient populations, that you're not going to be cross-transmitting either COVID-19 or any other organisms that we would not want to share amongst individuals. So that is the end of this presentation. There are a list of references that was used to help create this tutorial. Please feel free to go and look at one or all of these. You can find some really helpful information. I have attempted to summarize the information within these slides, so they are not completely comprehensive for all of the recommendations that you might find on these websites. If you have any specific questions, please feel free to reach out to mecdc.hai@maine.gov, and we are happy to help answer your questions. I hope that you have found this tutorial on respiratory protection and supply crisis strategies for PPE helpful, and stay safe.